It's hard not to think the worst of someone who works in a place known as the murder house. Now, of course, they don't deserve it, but the dental nurse had a fearsome reputation ever since the school dental service started way back in 1921. Now, when you see the seat that you had to sit in and the tools that they used, it's not surprising, really.
The service was started by Colonel Thomas Hunter, and he had been in charge of the Dental Corps during World War I, the Great War. During the war, he was absolutely appalled at the state of recruits' teeth. So after the war, he made it his personal crusade to wage war against dental disease. The first training school was in Whitmore Street, but by World War II, because the service was so successful, a fabulous new building was opened up in Weller Street in Wellington. These were fantastic modern new premises for what was essentially a production line for kids visiting the trainee dental nurses. The murder house became a popular term for going to the dental clinic, and the first documented use of the phrase murder house was in 1964. Certainly kids who went to the dental clinic in the golden days of the murder house didn't get any anaesthetics for fillings or tooth extractions. Dental nurses were nurses. They weren't dentists, and they were women. And they were actually modelled on the Plunkett nurse. This was because women were supposed to have a more maternal touch, and that would work really well with the children. It was also because they could be paid less. Women in the 20s and 30s would definitely not paid the same salary as men. The tools we've got here, which came from the dental training school, date from about the 1940s. We've got a couple of extractors. You get a good grip on those, that's for sure. They're not very delicate either. And this one is quite interesting. It would have been used to put the amalgam, the filling, into the place that had been drilled by the dental nurse. You'd push down on the presser there and squeeze in the amalgam into the tooth. They would definitely have sat in a chair like this, and they would have, the nurses would have used drills like this one here, which has got a treadle to make it go. You'd push your foot up and down on the treadle, and depending on how fast you wanted to go, that would be the speed of the drill.
These are a few of the several hundred items that were donated to Te Papa when the main Wellington dental clinic closed in the 1990s. Today, dental therapists are trained at the Polytech, and they continue the legacy of a group of women that have helped keep our teeth pearly white.